Okay, so this is prostate biopsy from a 79-year-old male who was found to have a PSA level of 8.9, which is a bit elevated. So the way I'm going to maneuver the slides here is you can see that there is a small rectangular shaped area here with another like a green rectangle, and this is where I can move the larger screen for you to focus on, so you can see where I'm focusing based on the small rectangle that is present here. So immediately we can appreciate that there are three cores. So at the moment we're focusing on the top two cores of biopsy, of the prostate biopsy, and what I want to highlight is number one, you can see that there is a variation in cellularity. So for example, this core here, which is quite low in cellularity, mostly stroma, and you can see the occasional glands scattered about. But as we move on to the top part of this core, you can see that it is extremely crowded, and it's all pretty much all glands and cellular elements here. This core is pretty okay, most of it is stroma and then occasional scattered glands. So if I now move to the bottom core again, similarly we have mostly stroma and then we have the occasional glands here. Okay, so I just want to focus on the lower part first to illustrate what normal prostatic tissue or prostate glands should look like. Okay, so the stroma is kind of fibromuscular, so you can see that there is the nuclei of the stroma there, and this is part of a gland, right? I'm sorry, my zooming in and out is not the best here, but what I want you to appreciate is this is part of a normal gland, and you can see that there's actually two layers of epithelial cells here. So one is a basal layer and the other one is the luminal epithelial cells. And even though some of them may have nucleoli, they are very small nucleoli, as you can see here, and they have very fine and even chromatin. Okay, so just to illustrate that a little bit further, I'm just going to move on to a couple more other benign looking glands. Okay, so here for example, again two layers, so one at the bottom and then a bit more elongated nuclei of the luminal epithelial cells. Here again two layers, one layer of the basal epithelium and the other one of the luminal epithelial cells. Okay, and that seems to be the general concept whenever you are dealing with a benign prostatic gland or prostatic tissue. Okay, so sometimes it's so obvious that even in low power you can see that there are two layers of epithelium. Okay, so now watch where my rectangle, green rectangle is moving on. Okay, so now I'm bringing you to that very, very crowded area on top of the top part, the top core rather. So as I mentioned earlier, it's very crowded. Okay, so there's hardly any stroma in between some of these glands, like for example between these cluster of glands you hardly see any stroma. So I'm just going to bring you up towards this area here. So again, everything is crowded, full of glands, somewhat different to the one we saw at the bottom, in that the glands at the bottom just now is quite dilated or open, and at the same time not just they're dilated and open, but also the lumen tends to be a little bit more kind of irregular, if you like. So here, for example, this is a malignant gland. Okay, and in general you can see there's only one layer of epithelium, right? So there is no basal layer of epithelium there. Again, if I move here, this malignant gland, this malignant gland, these are all malignant glands. Okay, and you can see that it's all single layered. And do you see how big these nucleoli are? They are very, very prominent. Okay, they're very, very prominent, although the chromatin is still quite regular, but they have very prominent nucleoli, and it's one of the features of prostatic adenocarcinoma. It's one of the tumors that tend to have prominent nucleoli. Okay, so I'm bringing you just all around to the crowded areas These are all malignant glands, so they all have just one layer of epithelium, and that is a principal characteristic of prostatic adenocarcinoma. They lose the basal epithelium, and the cells tend to have these nuclei, enlarged nuclei with prominent nucleoli. There are other characteristics that you may see in some other biopsies, but they're not present here as I move around. The prostatic carcinoma tends to have a predilection for perineural invasion, especially if you have resection, prostate resection. You may be able to see these malignant glands will encase or invade into the perineural space, so the nerves basically. Okay, so that's one of the characteristics. Occasionally you can see intraluminal mucin, okay, so it's such as kind of a bluish tinge to the intraluminal location of these glands, but they're not present here. Okay, so here's just to compare between a benign looking gland here with the malignant looking gland over here. Okay, so the nuclei are slightly larger with a prominent nucleoli, whereas and a single layer of epithelium, whereas here you have preserved basal epithelium. You can see that there's definitely more than one layer here, probably a little bit more hypoplastic and tufted up, but the two layers or preserved basal layer is quite evident. Okay, so this is prostatic adenocarcinoma.